Welcome everyone. I'm MPP Roman Baber, and it gives me great pleasure to welcome David Sweet, Conservative Member of Parliament for Flamborough Glanbrook here at Queen's Park. And I'll now invite MP Sweet to offer some remarks. Welcome, David.
Conference is now being recorded.
Thank you very much, Roman, and thank you for all those who are here present today as well as on virtually. Thank you for taking the time to report on our serious concerns regarding the pandemic, but specifically the government measures that have caused incalculable suffering for all Canadians. We extend our thanks to all the frontline workers for their dedication and Herculean efforts to care for all Canadians. This serious pandemic of COVID-19 has brought to light the important role that you play regularly for our health and well-being. Our heartfelt condolences to those who have lost friends and loved ones. Not only has your loss been tragic, but all too often it's been amplified by the inability to be with loved ones while they are afflicted. No one should be alone when they're facing their final breaths of life. Adding to this unthinkable misery is that the usual psychological closure for loved ones after someone passes away has been postponed or eliminated altogether by the fact that you're unable to have a proper funeral or memorial with extended family and friends. I'd also like to say to those who have suffered themselves from COVID-19 that we extend our best wishes for your full recovery and a return to a state of strength and vitality. We've had an opioid crisis that has taken the lives of so many, but has largely been unaddressed, and it's no secret that cancer screenings are down and cardiovascular treatments are limited. Early on in the pandemic, we got a glimpse of the collateral damage of lockdowns, but since then, we have heard little to nothing. Back then, the Ontario Minister of Health, just 1 month after the lockdowns, announced that 35 cardiac patients had likely died as a consequence to the lack of access to treatments because of the restrictions. These many restrictions are causing unparalleled risk to Canadians physically. Lockdowns, by their nature, are a threat to mental health. The animal kingdom is limited to hunting, eating, mating, and search for shelter. That's not so with us human beings. For a large part, what makes us human are birthdays, christenings, funerals, anniversaries, graduations, bar mitzvahs, church, synagogue, mosque services, going out for dinner on Valentine's Day, and fast approaching Easter and Passover. Psychological damage is huge during these lockdowns. The fabric of our villages, towns, and cities, our non-government institutions and community events are the glue and the real social safety net that brings us together and nourishes our mutual humanity. If these were the only concerns, they would be enough for a very open and respectful dialogue about the path forward, or what the path forward should be, particularly for those who are not at high risk, which is by far the majority of Canadians. But not only sociologically, then there is economic. The financial consequences that family businesses, entrepreneurs, and workers are experiencing because of lockdowns is huge. Restaurants Canada states that over 100,000 restaurants have closed in Canada. CFIB says that small businesses now bear $135 billion in debt due to government measures in response to the pandemic. Much of this debt was mandated by governments who wanted PPE, sanitization, plexiglass barriers, and the list goes on. It was assumed by businesses that these expenditures came with the promise that they could operate with these safety protocols in place. If they feel betrayed, I can surely sympathize with them. Need I even mention the aviation industry, tourism, hospitality, youth sports, personal grooming, even pet grooming services, and the theater sector, all have been decimated by these measures. The sheer incoherence of some of the measures add to the frustration Canadians increasingly feel. We've seen examples of families being ticketed outdoors where we know little to no transmission ever happens. Businesses on one side of the street are allowed to open while others on the other side must remain closed. Liquor stores, cannabis stores remain open. Huge box stores that plow thousands of people through their doors daily, free to welcome customers to purchase everything from a vacuum to fresh cut steaks, grab a hot dog or a burger on the way out, while the small business owner remains closed. My friend Roman has been criticized for his efforts to have the provincial government seriously consider a new path that includes substantial protection for vulnerable seniors and those with comorbidities and pre-existing conditions. MPP Baber, at the same time, has made it clear, as have many PhDs and scientists and doctors, that locking healthy people down is not a sustainable answer to try to stem the tide of a virus and only creates hardship for healthy people. The priority of government efforts should focus on the protection of the vulnerable in long-term care facilities, congregate settings, and establishing income supplementation programs for those with pre-existing conditions that prevent them from engaging in regular work while we await the full rollout of vaccines. In closing, let me say 4 points. We need to develop a pandemic plan that includes all those negatively affected by the present strategy, such as parents, children, seniors, small businesses, social enterprise, airlines, supply chains, etc. Governments must be more transparent, and protection of the elderly and vulnerable populations must be the focus of the efforts and resources. Those in long-term care facilities, retirement homes, and other congregate settings are proven to be the most vulnerable, and this is where the core of our efforts need to be. Bringing calm and confidence to citizens and demonstrating a united, healthy path forward is the job of government and will elicit compliance much more than the present practice we've seen. Put faith in our entrepreneurs to keep their shops safe. Our business owners and their employees want to stay open because it's their livelihood. So I believe that the vast majority will do the right thing to protect their staff and customers. And finally, I encourage all levels of government to be transparent with data and assure the rules make sense. The trust and unity of Canadians is eroded when rules seem to favor one group over another, and when numbers of COVID cases are published with no supporting health data for context, including suicide rates, deaths from lack of services for other life-threatening afflictions such as cancer, heart health, and the like. Thank you very much.
Did we want to come to the mayor? Thank you very much, David. Thank you for your courage, and thank you for being at Queen's Park here with me today. What MP Sweet and I are saying publicly is what many elected representatives are hearing and saying privately. People all over the province are hurting, and they're reaching out to their elected representatives. The effects of the lockdown are devastating to the health, mental health, and the economic and overall well-being of Ontarians. We need to focus our resources where they're required, which is long-term care homes and congregate living facilities. But we need to let people go back to a semblance of normal. That's the best thing we can do for the health of Ontarians. Together, we're calling on Premier Ford to move the entire province into the green zone. The difference between red and green isn't significant, except the numbers are loud. The establishments that will benefit most from going to green need it most, and they have not shown to be significant sources of spread, if at all. All measures such as distancing will remain in place, but there is no underestimating the psychological benefit this will make for Ontarians. We can do this. We can move forward responsibly. At the same time, we need to get it together and secure group homes, secure long-term care homes, retirement homes with proper infection control and staffing, and we will take 80% of the risk off the table. But we can no longer sustain the catastrophe of the lockdown. Ontarians are at their wits' end. People need to go back to work, kids need to go back to their routine, and we cannot continue with this path of forced isolation. It's cruel and inhumane. Let's restore healthcare services in full and move back to green and give Ontarians instant psychological and economic relief. Thank you. Thank you so much for being here with us. And with that, we'll take a few questions.
Ladies and gentlemen on the phone, as a reminder, should you have any questions, please press *1. Your first question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Thank you. Can you talk about why you are speaking out at this point? Mr. Sweet, the province is starting to roll back some of these measures.
Yeah, thank you very much for the question. And if you've followed my 15-year career at all, you know that I seldom, if ever, speak about another jurisdiction. But in this case, because of the Herculean effects that it's been having on my constituents, families, children, businesses, I was hopeful up until August that this would be resolved, and after that I continued to see these lockdowns getting worse and worse. And I felt it was my responsibility for the citizens of Flamborough, Glanbrook, and really for all Canadians to speak out and say enough is enough. The sociological, the psychological, the economic, and the physical health of Canadians is at risk.
Paula? Thank you. You have noticed, I'm sure, what has happened to Conservative MPPs who have voiced an opinion on this, standing right beside you there. Can you talk about how you feel your own party leader will react to this?
Well, look, I'm not, this isn't my party's position. My colleagues, I'm certain, will speak for themselves. I'm not certain exactly how they will react. I have my experience, obviously, in politics has been you should stay on message and stay with the party line. But when I see the consequences of the actions of not only this government but other provincial governments as well, I think it's incumbent upon me, after being elected by the citizens of the riding I represent, as well as swearing an oath to the Queen, that I do the right thing and speak out about the great damage that this is causing many, many Ontarians.
There are no further questions on the phone.
Oh, Mr. Sweet, I have a couple of questions. You are obviously not running for re-election, which is perhaps why you don't feel like there would be any repercussions from the party for coming out. Do you feel like Mr. O'Toole will take any action against you? I mean, he's already stripped you of a lot of your responsibilities in the House of Commons. Are you fearing that you could be kicked out of the party for this?
Look, obviously you don't make these kind of decisions, willy-nilly. Like I said, I've been thinking about this very seriously since last August. Been reading epidemiological and virology papers since the pandemic started. What most people don't know is for the last 12 years, I've been very involved with the infectious disease lab at McMaster, trying to get funding from both governments so far now to make sure that we're ready for these pandemics. And so this was very important to me. And as the lockdowns continued, I felt that whether there was a consequence or not, I have a responsibility and obligation to the citizens I represent to speak out, and that's why I did.
And so you don't fear a repercussion from the party?
Look, they will do what they need to do, and I've been around long enough that I know that I need to weather whatever comes in politics, and I've done that for the last 15 years, and I'll do it no matter what the repercussions from my party are.
You speak to your caucus colleagues, obviously. Is your feeling about the lockdowns, is that shared among the membership within the CPC?
Look, I'll let them speak for themselves, but I can tell you that my concerns are not, they didn't derive from me alone. They derive from many phone calls, many emails, many conversations, many concerns in the broad context of Canadians. And that's why I'm speaking out today. But I'll let my colleagues speak on for their own responsibilities.
There was a story in the Toronto Star about the growing concern within the Conservative caucus about Erin O'Toole embracing the idea of a federal carbon tax. Can you tell me what your concerns are, and whether that is widely shared as well, about the leader potentially adopting the idea or embracing the idea of a carbon tax?
Now, the first thing that I saw was the article itself. There was no evidence to me through any caucus meetings or any direct conversations with Mr. O'Toole in his regard to changing our party position. It's always been that we're against a carbon tax, and I have no concern at all that he's changed his position whatsoever.
All right. Thank you.
Do you believe science is backing you in your thoughts here?
Yes, absolutely. There's tens of thousands of PhDs, of virologists, of doctors, lots of clinical evidence. I just got an email this morning from a professional counselor that I know, talking about the devastation to his clients with an increase in the clients that he's seeing of domestic violence and of just giving up and having suicidal thoughts when they had originally just come to him because they were having some bouts of depression. So yes, I think it's backed up by a lot of science, and from the Great Barrington Declaration all the way through to numerous other articles that have been written by PhDs and scientists here in Canada.
Are your thoughts still the same, even though we know that there's new variants out there that are far more transmissible than the old virus, the original virus?
I'm going to let MPP Baber answer that because he's done some specific research in that regard.
Thank you, MP Sweet. And thank you for the question with respect to the variants. So typically the dire predictions of the COVID command table rarely come to fruition, even when they meet the trajectory or best case scenario. You know, a recent study out of the UK concluded that there are already more than 4,000 COVID variants. It's corona. Corona mutates, and there will always be a new variant. And it's not clear that the current vaccine formula will work against all of them. But we should not shut down all of life because of variants. Instead, we know what COVID does and who it typically attacks. And let's secure the vulnerable in long-term care homes and retirement homes with proper infection control and adequate staffing. But we need to stop locking down healthy people and making them sick.
Mr. Baker, just one thing for me. Are you planning to get vaccinated when your turn comes?
Yes, absolutely. Because, well, I have faith that the vaccine is effective. We haven't seen any evidence thus far to suggest that there's any considerable risk, and I'll encourage all Ontarians who wish to be vaccinated to get vaccinated. What I'm saying,
you've expressed a lot of doubt about the pandemic itself, about whether all of this is real.
I have not expressed any of that. COVID is a very serious infection. We know that it can be very, very dangerous to certain demographics, particularly folks in long-term care over 80 with serious comorbidities. So with respect, Mr. DeMello, that's incorrect. However,
but you still want protection yourself from
no, I would encourage any Ontarian who wants to get vaccinated to get vaccinated. I'm saying something else. I'm saying that ever-evolving variants and slow rollout and challenges in production, with potentially Moderna needing to come up with another formula, with Pfizer suggesting that there may be a need for a third booster shot, that the vaccine in and of itself may not be a viable exit strategy in and of its own. Thank you.
Can I just follow that? I just want to make sure that I'm on the record as well. My opening remarks.
Sorry.
The first sentence of my opening remarks were very clear. We both agree that COVID-19 is a very serious pandemic. And over the last year, the science has evolved. We know exactly who the people are at most risk. And all we're saying is that make sure you protect those people that are vulnerable, that have comorbidities, that have pre-existing conditions, that are seniors, and don't harm healthy people by locking them down. That's our key message, and that's what we're standing by.
Thank you.
Thanks, everybody.
Thanks, folks.